Welcome to the Power of Peacefulness podcast. We're all about bringing peace into your life. If you're looking for peace, do me a favor, go to my website at sharonmclaughlinmd.com/workbook and download your peacefulness workbook today. Get started. Take a pen, a pad, and start writing. Today, you don't want to miss this episode. It's all about the stigma of mental health. Now, in medicine, it's a problem because most healthcare workers can't go ahead and speak up and say there's a problem. I'm feeling depressed. I'm feeling anxious. There are changes being made, and we're going to hear about that today. But imagine that you're a healthcare worker, your physician, not being able to speak up because of the stigma of mental health. Hey, everybody. Today we have Dr. Michael Foti with us. He's going to be talking about the stigma that goes around mental health. As I mentioned, he's a physician. He wanted to come on and talk about mental health. Michael, so great to have you, Dr. Foti. Go ahead and introduce yourself.
Yeah. Thank you so much for having me. So yes, my name is Dr. Michael Foti, internal medicine physician by training. Currently, I'm a full-time faculty at the Touro College of Osteopathic Medicine in the Department of Primary Care. I'm also a member of the board of directors for the New York State Osteopathic Medical Society. And as of pretty recently, I'm now the vice president of the National Alliance on Mental Illness in Orange County, New York. So it's nice to meet all of you.
Congratulations.
Thank you.
You had written, I'd like to be on your podcast to speak about the stigma of mental health. What does this mean to you? Any personal experience, family experience? Just take it away.
Of course. So for what it means to me, I mean, I do have personal experience with that, and I'll get into that in a bit, but I think that the stigma, and again, this applies, I believe, to healthcare professionals, but I believe it also applies to anyone, where if we're suffering from mental illness, whether that be anxiety, depression, or anything else, we don't feel empowered to get the help that we need. We feel that it's something that we shouldn't speak about, that we should just push forward. Sometimes it's felt to be almost a weakness, and we just need to, push through it because, we tend to question, why is this happening to me? And I think that stigma has come about because we don't speak enough about mental health. And it's almost felt to be something swept under the rug. And I'm here to empower others to get the help that they need because I did suffer in silence myself. So when COVID first arrived, in the spring of 2020, which we all remember, I was in my intern year, or for your viewers who are not in the healthcare field, that's basically your first year of training in our residency program. So you are a doctor, but you're in your first year of training. And so it's a lot. Obviously, it was a lot for everyone, well, whatever year of training or not, or even, for those attending physicians and any other staff in the healthcare field, it was a lot. This is a pandemic we haven't seen for 100 years, as they say. And, but for someone in their first year of training, you can imagine. And this was, 12 to 16-hour days of very intense work. And what really made it hard was you were seeing people in their 30s and 40s, people close to my age who were suffering and dying from this very devastating illness. And so that was a big part of what eventually led to my mental health struggles. And on top of that, around the same time, my mother unfortunately passed away pretty suddenly at the age of 54 to what we found to be undiagnosed stage 4 lung cancer. And she died from complications of that within really a few weeks. So it was relatively sudden. So I dealt with a lot in just a short amount of time. And once I finished my residency training was when a lot of my mental health struggles manifested. I developed a pretty severe panic disorder, which would manifest as a very intense pressure on my chest, as if someone was trying to rip open my chest, as if someone was trying to squeeze my left arm off. It was really an unbearable feeling that I would never wish on anyone. It was terrible. And this was every night for months. And then even during the day, I would have constant fluttering in my chest. And it was really unbearable. And again, this carried on for about 3 or 4 months, and to the point where I wound up switching jobs thinking that it was the job. But it persisted, and I was losing sleep from it. And I thought I felt like I was getting sick, and I had to leave work early. I had colleagues covering my patients, and it was really just a really dark time for me. And I felt very ashamed because of the stigma. And as I mentioned, because I said to myself, why is this happening to me? Why can't I do this? And my whole life, the expectation was I was going to be a doctor, and as if my world was crumbling around me, really is what it felt like. I can remember shuddering away in my basement, away from my family, away from my wife and my son. I could still remember my son's cries from upstairs, "Daddy, Daddy," and I'm downstairs, just so ashamed to even look them in the face. And it was a very, very dark time for me. Though one day I eventually said to myself, I need to get help. If not for me, but for my wife and my son, I need to get the help that I need. And I did. I saw my doctor, my primary care doctor, who started me on an antidepressant medication, which for your viewers, if you don't know, that's a medication that you take every day for anxiety or depression, or really helps for both. And I was referred to a psychologist who I started seeing weekly. I took a medical leave. I said, I need to take care of myself. I've been taking care of people for so long. I need to take care of myself. And I did it. So I took a leave, saw a psychologist every week, and I put the work on me. And I'm proud to say that I got better and realized a lot about myself during that time as well.
Michael, I wanted to touch upon, for the public that doesn't know that, that's out there listening. When it comes to healthcare workers, I don't know about nurses, but I would imagine so. My husband's a CRNA. He does get asked these questions. When it comes to having privileges at a hospital, or even having your state license, your medical license, many states and hospitals will ask about mental health. Do you have a history of mental health? Are you able to do this job? Kind of like different questions along this line. So what can be done, or do you know if anything's being, like, first of all, I wanted to point that out, that this occurs. And this is a reason why many physicians don't want to go and seek help, because they're afraid, right? They've worked so hard many years to try to get into medical school residency. And now they're at a point where they're practicing, and they know that if they seek mental health, that potentially, if you go ahead and write no, that's unethical, right? But if you go ahead and write, yes, I do have mental health issues, concerns, whether it's anxiety or depression, that maybe this is going to be held against me.
That's a great question. I mean, that was something that I looked up myself. And, obviously it was a concern for me at the time. And for those who may not know, mental health, such as anxiety and depression, are protected disabilities under the ADA. So as protected disabilities, you do not have to voluntarily disclose them. Now, in terms of work that's being done, I'm hoping that this doesn't even or shouldn't be an issue, and because there is work being done on this. So for those who may not know, there was a physician, her name was Dr. Lorna Breen, and at the height of the first wave of the COVID-19 pandemic, she unfortunately took her life. And there is a now Dr. Lorna Breen Heroes Foundation in her honor. And there was actually what is now a national day, and I was a part of, called the now Health Workforce Wellbeing Day in Washington, D.C. I was invited by the National Academy of Medicine actually to speak alongside the U.S. Surgeon General on health workforce well-being. And it was really, one of the honors of my life. And but the reason I bring this up is because that Action Collaborative has now developed what's called the Dr. Lorna Breen Provider Protection Act, which is going to award grants to hospitals and any healthcare facilities who campaign on mental health and provide services to their health workforce, anyone in the health workforce. And I'm so proud of that. I can't wait for it to fully pass through the Senate and get approved, because, campaigning on mental health at that institutional level will allow so many in the health workforce to feel empowered to say, hey, they're putting this at the forefront. They say I can speak up now and get help, and they'll feel empowered to get the help that they need. And so that's what's being done. That's a part about why I didn't speak up at first, and that's why I suffered in silence. But the thing is that, and I think that's why a lot of work is being done on mental health for everyone, but especially in the health workforce. We tend to forget that doctors and nurses and PAs and everyone in the health workforce, we're expected to be perfect, but we tend to forget that we're human beings too. And mental health is just very much part of the human experience. If you've experienced loss or witnessed suffering and death, and then you develop something like anxiety and depression afterward, that's part of the human experience. To expect someone else that it's okay to develop that, and not for someone like me who's a physician, it's unfair, it's naive, and that's why with so much work I think is being done now for it. On top of the statistics that are showing that, we're in a mental health crisis. Physician suicide is on the rise. A third of medical students in the entire country are suffering from anxiety or depression. I mean, these are staggering numbers. And so a lot's being done, and I'm very proud of that.
You should be proud of that. I suffered from anxiety. It was one of the reasons why I ended up burnt out and actually walking away from my plastic surgery practice. It was just
So
too much,
yeah, I'm sorry that you went through that.
I know that's part of why we're doing our message now, right? Where we're here today. So it was a
100%.
path.
Hmm.
Looking back, and for those who, whether you're a physician, healthcare worker, general public listening out there, where do you start with the mental health? Like you realize that I always think it starts with awareness. Could you provide people with like maybe 3 tips as far as mental health and getting help and what you think helped you?
100%. Yeah. So, I mean, I think that first step in getting the help that you need, speaking to someone, I think that's the first thing because, whatever profession you're in, you can't be your best self for your profession, and you can't be your best self for your family and friends and those around you, and really just for yourself if you don't get that help that you need, right? So for the healthcare workers that are listening, you can't be healers if you don't first heal yourself, right? There's that old saying of if you're on a plane and the oxygen mask comes down, you got to put yours on first before you put on the next person's, right? So that's the one tip is to speak to someone, even if it's first just your primary care doctor or just going directly to look to speak to a therapist or a psychologist. I tell you, it's the best decision I ever made, and I'm so happy I did it. I'm in such a better place. So that would be the first tip. The second tip is to be kind to yourself. I say this often, but I think no matter the profession, we tend to be hard on ourselves and say, "Oh, why am I going through this? I shouldn't be going through this." Well, it's okay. It's okay to not be okay. That's part of being a human being. But it's that much more important to seek help, right? But just remember to tell yourself, it's okay, I'm going through this, but I'm going to do what I need to do for me. So that would be my second tip. And my third tip really is, once you're, you know, getting that help, right? And you're really in that journey, right? Remind yourself, hey, I got myself here, right? Like that was a big step in and of itself. Because once you start on this journey, you're like, oh man, this is going to be a lot. It's not something that's just fixed overnight. It's not something that's worked on overnight. I'm still working on myself, right? And then we're talking about 3, 4 years later. It's a long journey, but to constantly remind yourself that it's a lot just to get yourself in that chair to sit in front of someone and talk about this. It's very vulnerable. It's a very vulnerable setting. So be proud of yourself of that, and remember that that alone was a huge step. Pat yourself on the back, but realize it is a long journey.
Michael, I wanted to touch upon your book. You have a book that's out. It's called Grief, A Doctor's Battle with Anxiety and Depression. Let's talk a little about that. You wanted to write it to hopefully get the word out there. Tell us about the book.
Yes, thanks so much. Yeah. So grief was something that initially started really as something therapeutic. So my psychologist said, Michael, I think you need to just start writing these experiences down. And I think it'll help you with, closure on a lot of the loss that you suffered and really be something. So I did. I just started writing down a lot of the experiences and patient stories that shaped my time during the COVID pandemic, also about the loss of my mother and a lot of that. And I just started writing it down. And a couple months in, I'm like, well, this is something here. And then at the same time, a couple months after I started writing it is when I first started sharing my story with others. My first time I shared my story was actually here at Touro, and I received such overwhelmingly positive feedback from my students and others coming up to me and saying, "Wow, thank you so much for sharing." And others experiencing similar things and feeling empowered to get help. I said, "Well, I can reach so many more people with a book." And I've had several speaking engagements and it's been phenomenal. But who knows? That may stop one day. Maybe people stop asking me to talk, or people stop saying, no, I don't want you on my podcast, which I hope not. But, who knows? But I knew I could reach a lot of people with this book. And that's why writing it and putting it out there was completely altruistic, because I'm just trying to share my story and get it out to as many people as I can. So, like you mentioned, it's called Grief, A Doctor's Battle with Anxiety and Depression. It's in honor of my mother, which you'll see on the first page. And it's out on Amazon and Barnes and Noble. And I'm just trying to get my story out there and empower as many people as I can. And that's really why I wrote it.
Thank you so much for being here. If people want to work with you, they want to reach out to you, how do they do that?
Yeah, of course. I'm on LinkedIn, so Michael Foti, DO. And I'm also on Instagram, Dr. Foti129. So either or, please reach out.
Michael, Dr. Foti, thank you so much for coming on today and sharing your wisdom and helping others.
Thank you so much, Aaron. I really appreciate being here. This is phenomenal.